Well, nobody really prepares you for house job. Nobody. Like I always say, there's not so much of a difference between being a medical student and a house officer. And it's not only that, Kida. There's not much of a difference between a senior registrar and a consultant. You see, the only thing that happens is that somebody has just told you today that you have satisfied us as examiners, and then you can be the next, you can go into the next level. That's all. Not any difference in your knowledge base, in the way you've been handling patients. No difference. So this moment you're a medical student, and then the next moment you've passed your exams, and then you're a house officer. And this period of house job is very, very important. These are things that nobody told me, but I think you need to know about these things. I've watched house officers develop over the past how many years since I've been practicing medicine, and there are a lot of things that I think house officers need to know that would actually help their practice. This video is going to be comprehensive. Don't listen to this in a hurry. Take your time, listen to everything, and you'll be glad you did. Alright, so the first thing I'm going to tell you is that house job is going to eat you. It's going to eat you like something you are not expecting. Many house officers within the first week would wonder why they are doing house job, and would wonder why they shouldn't even quit. Let me give you examples of the things that would happen to you during your first month of house job. You're going to be jumping from one place to the other, looking to try get investigation results, get blood, get consent, get the patient, get different things, and you'll be confused. People are going to shout at you, your seniors. The registrar will shout at you, the senior registrar will shout at you, the consultant will shout at you. Okay, let me say maybe not always. They don't always shout at you. The nurses may shout at you. The attendants may shout at you. Patients may shout at you. It's normal. It's not because you're a bad doctor. Just know that that is how it happens to many people, right? You are going to be confused. It will be like you don't know anything. You know the way when you read books for your exams and the exams are closed and it feels your brain is empty. That's exactly how it's going to feel, like you don't know anything. That like medical school has been a waste. That's the way it's going to look. There's nothing abnormal about it. We've all passed through those things, right? You will feel incompetent. Incompetent means that a patient comes before you and you just don't know what to do, and then you're like, everybody has been calling me doctor, but here I am, I don't know what to do about this situation. There's nothing unusual about it. Cheer up, because it's going to get better. Let's go into some practical things. When you're doing house job is practical. It's not just about you reading big stuff. Read big stuff. No. I advise that you make your house job patient-based, meaning that if you are going to do your surgery posting, for example, read around each case that you have on your ward. Read around each case that you see in clinic. So you must have a small notebook where you are going to be writing out things. So for every case you see every day, read something. Even read something about the case, even if it's for 15 minutes. You just go online, go to your something short, maybe in one of those handbooks, just read about it and jot something. If it's about appendicitis, read it. Don't try and read a compendium of appendicitis, something that is supposed to take you 1 week or 1 month to read. Read something that is very summarized, something that you can finish within 15-30 minutes, and then take note of every detail of how that particular patient is managed. Watch At every point, everyone that is seeing the patient, what have they written for the patient? What is their plan? Write it and note it, so that next time you see a similar patient, you would remember this was how the patient was managed. So you can see that's a very smart way of doing it. The other thing I want to talk about is our job is a time to know about doses. Note the doses of medication. It's not for us to say what's the dose of paracetamol and you're like, yeah, it's 1 gram a time. That's not the dose of paracetamol. This is the time to know the mechanism of action of those drugs. So many times you just see what's the treatment, ceftriaxone, flagyl, and I ask you what is the mechanism of action of flagyl, and you don't know. You are supposed to know. You don't need to know the in-depth, just know, okay, this is basically the way it works. Alright, so in medical school you are just cramming all those mechanisms of action for exams and you probably just forget, but now is the time to know for the common drugs, just know how they work. Before I leave, and the reason why these drugs are very important is you need to also know how those drugs are used, right? So if a consultant likes to use a particular medication, try to know why. If someone else doesn't like, know why. Know side effects of those medications, so that when you start practicing on your own, you will easily know that, oh, this is the side effect. Yeah, so the other thing I try to tell us officers to do is this: when you are doing a round or you are carrying out patron orders, note everything you are doing for each patient. So if you are giving a patient normal saline, know the composition of normal saline. As simple as that. So look on the bottle, oh, this is the composition. Then look in the text or online and see exactly what it contains. If somebody likes to give full strength diamonds, look at the composition of full strength diamonds. That will help a lot. And before you know it, you will know many things just naturally. So right there in your book, you should know how to manage. You should know drug doses. If you can get a formulary, it would really help, because formularies give a little bit of a background to common conditions. So maybe like asthma, it gives you a little introduction to what asthma is, and then it now tells you how is asthma treated. It tells you a little bit about meningitis, tetanus, things like that, and how it's treated. That way you will be good outcomes. The next thing I want to talk about is know your hospital setting. Hospital settings are different. So whether you are going to do your house job in a tertiary hospital like UCH or you want to do it in Luth, is completely different from doing it in some of these private owned university teaching hospitals or general hospitals. What is required of you as a house officer is different. So are you required to run after samples? Are you required to get blood from the blood bank? You need to know, because if you don't have to, then you will save your energy doing other useful things. So you don't keep running around. When you know that there's probably a hospital porter or an assistant who will go to the laboratory to get the results, or who will go to the pharmacy to get medication. You don't have to stress yourself doing all those kind of things. All you need to make sure is that those samples are taken early. You need to know who is responsible for each thing, so that you don't waste your energy. For example, if you need to get something done easily and you know that, well, if I just discuss this with the nurses, it will be done, just do it. You don't need to waste your energy on things that are not necessary. So that's part of you knowing how the hospital works, right? The other thing to talk about now is the other staff you work with. And as a doctor, who do you work with the most? Is nurses. They are the ones always there. And it's just like you are a football. Imagine that you are a footballer. You know that there are people that work in the football stadium that support these footballers. They are the mid-level staff that have been there for 30 years. They know all the runnings of the club. Footballers will just come, have a career, 5 years, 10 years, and leave. 5 years, 10 years leave. So when you get there, there are some nurses that you will meet that have been there for years and years. And these people will be able to give you a lot of advice. They may not know a lot of theory of medicine, of course, because that's not their training. But you'll find out that they know that, this doctor, when this doctor came, this is the way he did it. When this other doctor came, this is the way he did it. And this was, their end results were different. So if you are close to that nurse, she will tell you that, well, there's this particular doctor, this is usually where he puts the intravenous access, and they do very well, right? So get close to them. Don't get too close such that there's a way you can get too close to them so that if they do something wrong, you'll not be able to tell them they did something wrong. Right? So know the boundaries, but the key thing is that nurses can be of a lot of help to you. So don't just be proud and boastful and say, what does this nurse even know? I know all of it. It's not true. You are a young doctor, you are inexperienced, and you need a lot of guidance. The other people aside the nurses, even the hospital assistants, cleaners, those people can be of immense help to you. Don't look down on them. Do not look down on them. Never be too proud to listen. Listen. It doesn't cost you anything to listen to somebody's opinion. Alright, so the other thing that, of course, the people that are ahead of you now, you need to learn not to hold information to yourself. So you'll see a patient who has a problem, you think that the solution is paracetamol, right? Don't just say that you give paracetamol and close it. Always pass it to someone senior. You never could tell. Maybe it might not be paracetamol that is required. Maybe something very dangerous is happening. But because you just assume that, it's something very simple, I know this one. Don't always assume. You are a young doctor. Always ask the seniors. Always ask questions. Always ask anytime you have the opportunities to. Things you don't understand. So you are doing a round with your registrar. Ask. You are doing rounds with consultants. Ask questions. This brings me to preparation for consultant ward rounds. This house job is for your own development. It's not for the development of the consultant. So it means that there are a number of things that you need to just do to make yourself develop, regardless of whether your consultant is interested or not. And what is one of those things? You know that most of the contacts you are going to have with the consultant is during ward rounds, when you are asked to present case summaries of the patients. So it means that you must make sure that you do those case summaries. You know what? If you don't do the case summaries, the consultant is going to manage the patient. He knows the patient. He may even know the patient more than you, or the registrar may present the patient. But you are the one that is losing by not presenting. Doing a pre-consultant ward round summary is so important. So you take your time, go through everything that's been done for the patient, understand it, study it, and then write a summary. Basically, what do you need in a summary? You need to tell us the age of the patient. You need to tell us what the patient was being managed for before. Probably if the patient is a known patient. Or if it's a new patient, you need to tell us a very short history of the presenting complaints, the essential things. So it's not a full, it's a summary presentation. You need to now tell us what was the diagnosis, what has been done for the patient, and if the patient has surgery, for example, you now need to tell us what were the intraoperative findings, post-operatively, what have we been doing, what have been the challenges, and what is your current plan as at this morning. That's what shows that as a house officer, you are getting on with the job. When you do this, the consultants recognizes the effort you are putting into it. Try to make case presentations. Try to present at departmental meetings. This brings me to theater sessions. I found out that many house officers run away from theater sessions. It is part of your training, whether you want to become a surgeon or not. If you decide to go into community medicine, or you decide to go into radiology or something, wouldn't it be nice that you can say, yes, as a house officer, I assisted enuraphy. I have an idea of how breast lumps are removed. Wouldn't it be nice? Yes, it would. So don't ignore opportunities to assist him. Don't say that, oh, you want to do or you want to work on the ward. Meanwhile, you have finished all the ward work and you are just sitting down, lounging, pretending to be doing ward work. Try to come to theater and be involved. Sometimes you may think that you are in radiology, right? And then something surgical will happen in the radiology suite. And then you become flustered and you'll be shaking because you've not seen that much blood coming out before. And then you start calling and start calling. But if you have applied yourself a lot during your house job, this will not be a big deal for you. This brings me to documentation. Documentation is very, very important. So document clearly. Be aware of why this is being written. Don't just write for the fun of writing. Documentation is what shows that something actually took place. So if you give drugs and you don't document, it's assumed that it was not given. And so learn to always document. If you discuss something with a patient and they give you a response, write it down there. You should watch the video on medical legal essentials for doctors. Watch that video. I'll put the link below. It contains lots of information that you need to protect yourself. So document very clearly. Sometimes you think that signing, for example, that discharge against medical advice form, there's one form that you sign and you think that once you have signed, the patient has signed that form, everything is fine. No, that form is just, I always tell people, the most important thing is that you've documented your interaction with the patient clearly, because most times those forms don't contain all those information. It just shows the name, the address, and okay, I want to go away. Patient can come back and say that, well, yes, I said I wanted to go away, but you did not explain the implications of me going away. So those are the things that you would need to document. All right. You need to manage your emotions as a house officer. Now is the time where you will see patients that you've been close to, you see them die. See, as a medical student, it might not have really occurred to you, but now you have taken care of a patient for several days and the patient dies. It can affect your emotions. It can make you down. It can make you depressed because you begin to question some of the things you are doing and say, oh, was there something I should have done? Could it have been because I gave this medication? Was it because there was a little bit of air in that injection that the patient died? And you will not be able to voice it out. So you must be able to manage your emotions. Know that every decision or every outcome does not primarily have to do with you. So it's not all about you. So that's number one about managing your emotions. Don't let bad outcomes get to you so much. Learn to open up even if you feel that way so that you can be guided. Learn not to be too emotionally attached to patients. You know that you are not supposed to have romantic relationships with patients so long as they are your patients. Okay, so but by virtue of what you do, patients will become really attached to you. So you must know how to manage those emotions. Okay, your reputation is so important. So once everybody knows, oh, that house officer is a very hardworking house officer, that is just it. That's the end of it. Everybody believes it. You are the hardworking house officer. Everybody believes it. But once everybody sees you as being lazy, even when you now start being hardworking, they will still be seeing the laziness inside of you. So make sure you protect your reputation. Before we go, I want to talk about finances. You start being paid and you think that money is big money. I tell you for sure, that money is is nothing. It's just because you've never been paid salary before, so it looks like big money. If you put together all your house job money, in those, it's maybe like 10 years ago, maybe if you put together all that money, it could actually be enough to buy you a kind of car. But if you put together that kind of money now, you buy a car, you probably spend the rest of your salary servicing the car or dealing with car problems. So it tells you that money is small, but because that money is just getting to your account, you feel like, wow, I'm on top of the world. They just paid me this amount of money. Learn to plan. This is when planning actually starts. If you are financially thrift, if you are financially disciplined, this is when you would start. Right? So always know that, oh, this is the amount of money I'm spending, this is the savings, this is the money I'm giving out, so that at the end of our job, you'll be able to point to something significant as being in your savings. So basically, if you look at the summary of everything I've said, the best medical student doesn't make the best house officer. I tell you that for sure. It's not all about brilliance. It's not all about reading all the books. It's about your commitment and your application to the care of patients, and of course being smart about it. I know you are going to have many questions. I may even make a secondary video if you ask a number of questions. But put your questions in the comments so that we can have a little bit of a discussion. I wish you all the best in your job as a house officer. You need to be in the hospital. Catch you some other time.